Joining us, Nick Barris, along with Dr. Gill Wright, Associate Medical Director for Metro Health. Your chance, if you'd like to join in the conversation this morning, the number there on the screen. We're also streaming live on Facebook at newschannel5.com. One of the Facebook comments from someone, they're wondering about the symptoms you talked about. Do you get them all at once, or is it a progression, and which comes first, and where does it end up?
Right. It is a progression generally. Fever, aches, a little bit of a cough, maybe, and then later, potentially worsening of the fever, worsening of the cough, shortness of breath can occur, and then obviously if you become really ill, then you're going to become real short of breath, real trouble breathing, okay. And then that obviously would be where you need to be seen medically. But okay. Most of these people are going to be able to recover at home, treating just the symptoms. So Tylenol, good anti-inflammatory, helps with the fever. The aches, ibuprofen can also be used.
Now, some have said, and it's been online, right. I've seen this, that they heard that maybe some anti-inflammatories can in some way reduce your immune system, so maybe stick with acetaminophen right. as opposed to ibuprofen. Right. Is that a big deal if you have a preference for one over the other?
For this situation, it probably isn't. The real anti-inflammatories would be the steroids.
Okay, like
so if you have cortisone or you're on those type of medicines routinely, they would reduce your ability to fight infection. They help reduce the immune response, and so those are people that may be at higher risk for other complications related to this, the severe complications.
And one other comment I'm seeing here, and there's a lot coming in again on Facebook, but Carrie's asking, hey, what about daycares? Many of the schools are closed, but daycares, right. And some of them are still open. What do you think?
Daycares, we're talking with daycares on a daily basis, giving them recommendations on how they can perform their duties and take care of those children and all of that. One of the things that we saw in, I believe it was New York, or at least some of the other places, is actually some of the closed, I think it was YMCAs, actually opened some daycare centers for healthcare workers, because obviously we need our healthcare workers. And maybe as many as a third of nurses may have children at home, and we need those people now for this, and so they have to have somebody to take care of the children. So there are, they are actually in some cases opening those specifically. So
that makes sense. Yeah. And these healthcare workers on the front lines, thank goodness for them. Let's take a few phone calls. We'll go to Georgia. Georgia, good morning. Hi, Georgia. Are you there, Georgia?
Yes, I am.
Go ahead, ma'am.
I know it's probably been discussed before, but I am concerned. I know there's a lot of stores that are having hours for seniors. They go in, whatever type store, the materials that they touch, how long does the germs or whatever that makes you get this virus, how long does it stay on those materials?
Sure. So let's talk a little bit about that. If we met in a hallway and talked for a minute or two, walked on past, really is not an exposure. You have to spend a prolonged period of time, about 10 minutes together, and closer than 6 feet, for that to be a concern. As far as touching things, fairly quickly we believe that but it's a brand new virus, so we don't fully understand that completely yet. But going into the store and picking up an item, I would not be overly concerned about that. Anything that shipped in from, for instance, China was a big concern for a while. The virus doesn't last for the transport time that's Would not.
For instance, though, if I was infected and I had my cell phone, okay, and I've talked and I'd done and put it down, and then maybe 5 minutes later you said, Nick, can I borrow your cell phone? And I gave it to you and you handled it. Right. Would that virus potentially still be alive on the back of my phone?
Oh, there's that potential, and anything like that that's really close to your face, where you maybe, produce a little bit of particles from your breathing on it, I would want to wipe down.
Wipe it down.
Yeah.
I'm constantly wiping the phone down. I mean, that's just it. Yeah.
Well, and in things even like people don't even think about, like gas pump handles, buttons in an elevator, all of those things, as much as you can, you should try and avoid them. We still have to live our lives. We still need to do some of those things. So, but if you have a chance, if it's been a period of time, then the virus will die on there. We just really don't know that full time frame yet.
By the way, with regard to animals,
Yes.
can I catch it from my dog? Can I give it to my dog?
Well, no, we don't believe. I mean, we don't believe so. I mean, there was one case
That was on
we
the fur of,
saw.
I think, a Pekingese in China, and they didn't think that, and the dog never got sick.
Right.
So okay, and
Yeah.
well, is there any other truth besides and again, so animals, don't worry about that, but any other truth to maybe today's the first day of spring. Temperatures are going to start warming, we hope, and I expect, of course, they will. Could that have a factor like in other flu viruses?
Right.
Warm weather seems to kill it.
Right. Well, we have to remember this isn't a flu virus, so
Okay, right.
it's a different group,
It's a different
and
group.
it could react differently. Again, brand new. It's only been around for a few months. We hope that it will follow kind of the same pattern as other flu viruses,
Just don't know.
as flu viruses have. We just don't know. But it's all very public. Tom Hanks and his wife had it. They were in the southern hemisphere where it's summer now.
Okay.
So not sure.
Not sure. And by the way, just so we're clear, because a lot of people say, well, it's just like the flu. Just clarify for people when you say it is a different subgroup than the flu.
Absolutely.
This should be called a virus, a coronavirus, but that's a big umbrella term.
Right,
I mean,
right.
COVID-19 is what I know it is. So how is it different than the flu?
Right. Well, the flu is typically more of an upper respiratory. This is more of a lower respiratory.
Okay.
So the symptoms vary a little bit. With upper respiratory, we think about your nose, your mouth, a little bit of a sore throat, runny nose, full ears. Then you get also with it maybe a cough and such. This is more lower respiratory, so it tends to be just the fever, the cough, some shortness of breath. You don't tend to get as many upper respiratory symptoms. So you don't have the runny nose, you don't have the sore throat typically, wouldn't have the full ears. You may have a headache with either one of them because mainly because of the fever and that type of thing. You may have muscle aches with both of them, and that's a little bit of the problem. We're still seeing a lot of flu. Symptoms
Right,
are
that's still
similar,
out there.
and now we've got allergy season, so that also makes it a little confusing as to what people have.
All right, let's go next to Janet. I believe we have Janet's up next. Hello, Janet. What's your question?
Oh, good morning.
Good morning.
Well, it may be dumb, and I know they don't know a whole lot about this, but I'm 66, and I had the Prevnar 13, and I know that's for pneumonia. So does this happen to maybe help a little bit, or does it know anything about it yet?
And Janet, that's a great question. There are no stupid questions when it comes to this.
No,
you go ahead and
absolutely
ask.
not.
That's a good question.
So the people that are getting pneumonia, because some people are getting pneumonia as a complication of this virus, probably most of them are getting that from a reaction to the virus, but there are cases where people are getting secondary pneumonias, which the Prevnar may help prevent.
Okay.
So I think it is good. There are two different vaccines for pneumonia, and actually they cover different strains. So getting both of them and going, to your doctor, to one of the pharmacies, and getting those if you're over 60 is probably a good idea.
Okay, and I have to ask you this, because as amazing as it may sound, there are some out there who still think that maybe this is some type of fabrication. Let's be real clear. Is this a hoax?
No.
Okay.
Real virus.
Real virus. It's completely real. This is not made up. I just had to throw that out there. I wasn't asking because that's what I wondered, because I know the answer, but some still say that. What's the big deal? Is it a big deal?
I think it is a big deal. If you look at the numbers, if you take 100 people, 15 or 16 of those are going to have severe symptoms and complications, going to end up potentially in the hospital. It looks like about 1.5%, so about 1 to 2 people per 100 that get this will die. So I think it's a big deal.
Okay, and again, I hear from a lot of folks, well, okay, some people have died from this, but think how many people die from the flu every year. It's not, doesn't sound like it's as bad as that.
Right.
How would you answer that?
Well, I think they're both dangerous in their own way.
Is the big concern here is that there's just such an unknown here?
Right. The big thing is there is a lot of unknown. I think that we're finding more and more out about this virus as time goes on, and initially the percentage of people that might die seemed to be higher than this, but any deaths with any illness that can be prevented, I think is a big deal.
All right, let's go next to, I think we have a Joyce. Did I take Joyce? Joyce, are you there?
Yes.
Hi, Joyce. Go ahead. Hi, Joyce.
Yes, good morning.
Good morning. Go ahead. What's your question?
My question is, how do we, the people, go on now that they've signed the stimulus package? How and where do we go to try to get the relief?
Oh, the financial, and
Yeah.
again, that
Good
may be some
question,
outside
but-
your realm, but I don't know if you can touch
Good
on
question.
that.
I don't know a whole lot
Yeah.
about that. That's not my area of expertise.
And I can tell you this, we're going to get more details on that. A lot of people wondering
Right.
about the checks that are going to be mailed out and other relief, and that's an excellent question. And that's something I can tell you we're going to be discussing in the newsroom today in terms of what more we can learn. And as soon as the government releases that, I trust you, we'll have that on News Channel 5 later tonight. But a lot of people wondering that question, and it's a good one.
Absolutely.
Let's go next to Terry. Terry, go ahead. What's your question?
Yes, good morning.
Good morning.
Thank you for taking my call. My question is related to the fever discussion a little earlier.
Mm-hmm.
Okay, when I get a fever, my response is to take aspirin, which supposedly should reduce the fever. So would that make it more likely that I would not be able to be tested because I lack that symptom?
Oh, okay. So I guess your question would be then, if you're feeling these things before you go in, should you stop taking this so you become more symptomatic, or does that matter?
No, you should go ahead and treat the symptoms. I would be a little careful with aspirin just because in order to really control a fever, you have to take quite a little bit of it. It does cause you to have a little increased chance of bleeding, but it does work in that regard. So, but to have symptoms, no, you just let your provider know that you've had a fever. If you can document what it was at home, that's best. But you also let them know you're taking something that would reduce the fever. Mm-hmm. If you came into my office and I saw you and you told me, Doc, at home, my temperature is 102. I just took some Tylenol an hour ago, and I get a reading in my office that says it's 99. Well, that's pretty consistent. You've taken something within a short period of time that's going to reduce your fever. I'm going to look at the other symptoms and fit those in also to make a decision about what to do.
All right. On that note, we'll take a quick break. When we come back, more with Dr. Gill Wright from Metro Health. A lot of you following us on Facebook right now. I'm going to scan during the break through a lot of the comments, see if we can answer as many of those as possible. And if you're on hold, stay there. We've got some lines open, taking your calls for them as well. We'll be right back.